The following is a Shaw TV Public Affairs presentation. Constituency Report is produced as a public service by members of the BC Legislature through the facilities of Shaw TV.
Hi, my name is Hugo Wong. I am a reporter with Black Press up at the Peninsula News Review in Sydney, BC, and I am thrilled to have been invited back by the MLA for Saanich North and the Islands, Adam Olsen, to speak a little bit about issues in his constituency. Adam, hello.
Hey, Hugo. Thanks for accepting our second offer, and look forward to chatting about Saanich North and the Islands with you.
So you just finished another session in the legislature. Any highlights for you?
Well, we're halfway through the spring session. We have this long break. I think probably the biggest thing is the budget, the first budget of the NDP government. Some very, very good budget measures, investments that the government's making in British Columbians, and as well some controversial taxes around housing policy that we've been working through as well. So it's been definitely a learning experience as a new MLA.
So some of the big focuses in the budget are childcare and housing. Where can we see some of the green influence in both of those big issues?
Well, certainly during the election in 2017, we had a very comprehensive childcare plan that we put forward. We heard clearly that British Columbia families need support. Affordability in this province has been a challenge. It's been a challenge for young families, and so we put forward a lifelong learning program. And I think that if you take a look at the initiatives that the government's put forward, they were heavily influenced by the program that we put. I think it was an example of where minority governments can work together, and where we can take campaign platform promises and bring them together and mesh them together. And I think that what you see and what we see is being rolled out is a combination of the NDP commitments during the election and as well the Green commitments. In terms of housing, we put forward a very comprehensive housing policy that we released end of January, I think it was. And some of the pieces, not all of the pieces, were influencing the government's decisions in the budget. Certainly, since the budget's come out, we've also been working with them to improve some of the taxation measures that they put forward.
Now, on childcare, I want to know a little bit if you've heard from constituents about how it's going. I understand that there has been a deadline extension when it comes to providers applying for funding from the government. Yeah,
certainly I think that this is part of the growing pains of the program, and is the rollout of it, and there's a need, and there's an immediate need. And so I think the government wanted to move very quickly in rolling it out. We've had a number of emails come in with respect to how that rollout is going. I think the government's very, very well aware of some of the challenges that they're facing. And as with any program, as with any comprehensive, universal, affordable childcare program, that in a province that didn't have one, we're going to run into some challenges, and the government's working through it. My colleague Sonia Furstenau is leading on this file, and I think it's important to point out that families in our riding need affordable childcare. It's a critical piece of support that we can give families, and the government's working towards it.
How is the task force coming along for innovation and the emerging economy?
Right. Well, you know what? I think the Innovation Commissioner has been appointed. We're working towards the Emerging Economy Task Force, and that's going to be that program will be announced as well. I was just on the Saanich Peninsula. I was just at a company called 19 Labs. They create medical devices, interactive mobile medical devices. And I think that when we take a look at the businesses on the Saanich Peninsula, there's a lot of innovative businesses. This is exactly where we believe that the British Columbia economy needs to go, innovation and technology. There's a huge opportunity for us, not only in Saanich North and the Islands, but right across the province. And we really, really do look forward to the Emerging Economy Task Force that will help us move those companies forward, help them find investment, move them from being startups to solid, well-functioning businesses, and grow from small businesses to medium-sized businesses to large businesses. That's the kind of support that I think the government needs to provide the industry as it grows in this province.
Mm-hmm. Now, you brought up a health startup. I understand that you met with some healthcare providers earlier in the year. What did you hear?
I think the biggest takeaway for me in our consultations with them was thankfulness that they are being brought together, and it was I think something that kind of caught me off guard was that there aren't these forums for service providers to get together and talk about their challenges and opportunities and find out who's filling what need in the sector and how they can work together to help each other out. And so there was, even after the forum, I had a lot of conversations with healthcare service providers, and they were thankful that we did bring them together. We're going to continue the effort to have those conversations with service providers on the Saanich Peninsula. I know that there's been some meetings happened after that we weren't a part of because those relationships were started. I'm a firm believer in investing in building relationships, and a lot of the challenges that we have in our riding and a lot of the challenges that we have in our province can be solved when we bring people together and have conversations. And that's what we started in January, and I look forward to continuing to be a part of that in our riding.
Mm-hmm. A lot of the movement in the healthcare sector has been to networks. Can you tell me a little bit about the difference between that and what people might be used to today?
Yeah, I mean, so we have, in many aspects of government, we have largely a siloed experience where a ministry is dealing with its specific thing. And even in healthcare, service provider will deal with their specific part of the industry, their niche part of the industry. One of the things that all three parties in the last election and definitely the NDP and the Greens were talking about were team-based medical care, where we've got multiple practitioners working within the same office, providing to support for one another and ensuring that patients can access the right practitioner to help solve the challenges that they might have. And so we see that in the Peninsula Medical Clinic, Saanich Peninsula Medical Clinic in Sydney. We've got this starting to happen. There's some desire for it to continue to grow in Brentwood Bay as well. And as well, a new society is just formed on Salt Spring to deliver team-based medical care. I think gone are the days where you just go into your general practitioner and then get sent off to a specialist. The goal is to bring all medical practitioners, or as many medical practitioners, under one roof as we can to deliver a full suite of services to patients and to their clients. And so and the government is having some challenges in transitioning from the current way that medical services are delivered, but there is a commitment, and we see them starting to move towards it. And I think that the Saanich Peninsula and the Southern Gulf Islands are well positioned to be at the forefront of this transition that's happening in the province. It's important to note that on Galliano and Maine and Pender, there already is team-based healthcare. That's been going on out of necessity for many years. And so I think that we can learn, and the government can learn from what's going on those Southern Gulf Islands already to help improve the system as it rolls out.
That doesn't necessarily fix every issue. There is still a doctor shortage. Doctors still feel overworked. And how would you bring that up with the NDP government?
Well, look, I mean, I think that you're absolutely right. We're not going to solve all of the healthcare issues. It's almost half of our budget, 40% of our budget goes to delivering health services. It's a massive part of the operations of the provincial government. Certainly we need to train more doctors. We also need to be able to spread out the work across the practitioners better as well. There's lots and lots of nurse practitioners that are looking for their niche and their space within it, and they can work together with general practitioners and family health practitioners. The other piece of this, which I think is really, really important and a part that the BC Green Caucus is talking about, and that is well-being and prevention. We have largely a disease care program in our province. We fix problems. And I think that the government needs to invest much more in wellness and in preventative measures to make sure that people are not getting sick, rather than having a healthcare system that's focused on fixing sickness.
Mm-hmm. Does that necessarily bring in like technology, for example? I know some employers, for example, are using Fitbits or these kinds of tracking methods.
Yeah, I mean, totally. I think that there's a lot of technology that is helping us. I mean, our iPhones or our mobile devices are helping us with that as well. Apps, the app world will help us with that. I think as well, the government having those integrated and providing incentives to people to engage in fitness programs, absolutely. And to the point that I was talking about earlier with 19 labs, here's a device that can be used in remote parts of the province where perhaps there isn't a specialist or there isn't a general practitioner, where people can go into their pharmacy, as an example, and sit at that mobile, it's basically a little studio, and have a conversation with a healthcare professional in another city. I think part of the connectivity of our world and making sure that our cities and towns in remote parts and rural parts of our province and our country are connected will allow for us to be able to connect people with practitioners who could be anywhere in the world.
Mm-hmm. To move it back to a more basic level, while technology is all well and good, there's still some basic aspects that provincial healthcare don't cover, dental being one, mental health being another. Do you have any plans to sort of move the ball forward on either of those?
So we heard loud and clear in our conversations, specifically with the general practitioners. Actually, a couple of them mentioned to us that they asked the question, actually, it's really interesting, when did the mouth not become separated from the body? And so dental care, people go in with an abscessed tooth or into their medical doctor, and they can't really help them. They need to be going to a dentist. So I think that there is a desire from the medical practitioners for dental to be a part of it. And the other one that you mentioned was mental health. Look, I mean, we've got significant challenges in mental health and well-being in our province, and we've now got mental health and addictions as a separate ministry, and we're working toward, and the ministries are working pretty well together. I think that there's still a lot more that can be done to deal with the mental health challenges. We've gone a long way down this road where the kind of support for people has not been there, and it's going to take a while for the government to get its legs under it. And certainly we hear on the Gulf Islands, mental health is a massive challenge. Salt Spring Island, when we had our consultations over there, mental health and well-being was of the highest priority. And so clearly the government needs to move, and they need to move quickly on developing programs and services and support for mental health workers right across our riding.
And is there something more specific in particular to try and drive down some of that cost? There is, for example, counseling that's available, in provincial health, but also in private settings, and it can get kind of expensive.
I would say that there's a lot of social determinants that impact the health and well-being, mental health and well-being, access to quality housing, the right type of housing, making sure that people have access to a general practitioner or at least a team of people that can help with the healthcare needs that they have. I think that what's underrated in people's mental health is where they live and where they work and their commute and the time that they can spend with their family and the time that they can spend doing the things that they want. And so I think that it has got to be an integrated and a holistic approach. We've got to look at it right from how we develop our communities to where we develop the services and how we deliver those services to people, and making sure that there's ease of access. You can just think of a commute, for an example, and the type of stress that adds to a person who's sitting in their car in gridlock for large parts of the day, and the impact that has. And I don't think that when we think of mental health challenges, that we think of all of these little these little social determinants that impact someone's health and well-being, whether they're feeling guilty for being where they're at right now because they're in a car, they work a 40-minute drive away. My brother-in-law, for an example, just got a job much closer to their house, and he is calculating the impact that that's going to have not only on their economic and financial well-being, but on his physical and mental well-being as well. When I had the conversation about the change that he made, those were even above the amount of money that he was going to save in his transportation costs. So I think that's just one example, one that we've been talking about recently in our riding, but it's just one example of the complexity of the challenge that we have in front of us, and as well government needing to have a whole of government approach, an integrated approach to solving some of these challenges. Just throwing money into mental health programs, well, that will be part of the solution. It's not going to be the entire solution.
And very briefly, would you see that coming in like next year if housing and childcare is a focus this year? Would you see increased investments in health next?
Well, no. The government's made investments in health in this budget. Every year they're increasing, and I think that to the point of this, the health budget is increasing every year. They've got increased supports for seniors in this budget. They've got increased support for changing and evolving the healthcare system into a more team-based approach. So they're making investments in healthcare every year. I think part of what we have to understand is that there's a lot of investments that or changes that can be made in other ministries that will impact positively the healthcare budget.
And I guess we will be right back with a little more of a Constituency Report. And we are back. My name is Hugo Wong. I'm a reporter with Black Press of the Peninsula News Review, and I'm here talking to the MLA from Saanich North and the Islands, Adam Olsen. Earlier in the House, you brought up the issue of a Salmon Secretariat. Can you tell me a little bit about why that's an issue that you want to push?
Well, I come by it honestly. Salmon have, my father was a guide fisherman in the Saanich Inlet when I was a kid growing up. I spent a lot of time on his boat, fishing, a lot of tourists. It was an important industry for the Saanich Inlet. It's on my wedding, the salmon is on my wedding ring. It's in art all around my office. It's been an important part of who I am as a person. And when I started to ask questions about fish policy, wild fish policy, specifically in the context of aquaculture, the finfish aquaculture is a very hot button topic. We know it as fish farms. Mm-hmm. And so when I started to ask questions about it in question period and of ministers, one of the responses that we got was that there were 6 ministries that all took a, quote, lead role in wild fish policy. And it was at that point that I realized, well, if there's 6 ministries all leading on this, then I have to ask the question, is there anybody actually leading on fish policy? And so we continued to ask questions in budget estimates. I asked questions again more in question period. I asked some questions around steelhead, which coming back in shockingly low numbers in the Thompson River and as well in the Chilcotin River. They're now listed as endangered species. And I asked the question, who's actually leading on this file? Well, we find out that each ministry, whether it be Ministry of Transportation and Infrastructure or Municipal Affairs and Housing or Agriculture or Environment or Forest Lands and Natural Resource Operations, all have their decision-making capacity for their portfolio, and fish are on the side of, on the sort of side of the desk, or it is also an important intergovernmental relationship between the province and the feds with the Department of Fisheries and Oceans. So, noting all of that, noting the confusion, the complexity around this, what I proposed in question period to the Premier was whether or not he and his government would support a single office within government that could bring all of the decision making around wild fish policy, noting that that fish are one of the 4 foundational industries in our province. If he would create an office, a secretariat, or appoint a commissioner that could stand up and make policy with fish, with salmon, with wild salmon at the center.
Is that something that already exists in government? Is there already an office that we can look to or model to try and organize all these disparate entities?
Well, I mean, you take a look at the Climate Action Secretariat as an example of this. We have made commitments both at a national and an international level that we were going to take action on climate change, and a previous Gordon Campbell Liberal government established, and recognizing that there's multiple ministries that all have policy around climate action, environmental stewardship, habitat restoration, go across multiple ministries. And so they created a single office, and that office took a look at how to streamline and focus policy on climate action. And so taking that model, and also maybe even peeling off of the previous NDP's Fisheries Renewal BC. There's examples of this in the past. It's worked in the past. I think we can make it work again.
Mm-hmm. And are you looking for any specific policies from the province when it comes to trying to increase the numbers of salmon after some period of decline?
Yeah, so look, I mean, I think that what's important to point out is that I'm responsible for 7 ministries as the critic in this government as an opposition member. And one of the things that I needed to do pretty quickly was understand, how am I going to be an effective critic across such a broad swath of policy? And they're not small ministries either. Forest Lands and Natural Resource Operations is a massive ministry, transportation and infrastructure. And so in taking a look at salmon, something that I'm quite passionate about, it's a way for us to deal with, and our office in the legislature and in the constituency, it's a way for us to deal with this massive amount of policy through one single very emotional topic, wild salmon. And so when you take a look at changes that need to be made, we need to make changes in forestry practice. We have to protect our watersheds. Not only is it for the drinking water of our communities, but it's also for the health and well-being of nature and for the plants and animals around us. When you take a look at transportation and highways, when we're culverting a stream or when we're building a bridge, we have to be thinking about the fish and the wildlife that's passing through that or passing underneath it. Indigenous relations. There's huge implications when it comes to Indigenous relations in fish and the relationship between Indigenous people and fish in the province. And finally, I point out municipal affairs and housing. When we're developing our communities and the riparian areas that actually add quality and increase the value of our property and of our communities, those creeks, when they're full of fish, do that. When those creeks are dead and they're beaten up and we're not looking after them, it decreases the quality of life in our communities. And so there's a huge amount of habitat responsibility that the province has, so that we cannot just pass off to the Department of Fisheries and Oceans and say, oh, the feds got it, they're dealing with it. We have a lot more responsibility, frankly, than this government has been willing to take it to this stage. And it has huge implications in our riding, whether it be the southern Gulf Islands with the sockeye fishery from the Fraser River, or whether it be the creeks and streams on the Saanich Peninsula and the Gulf Islands that are our watersheds. We have a massive local, provincial, and federal job ahead of us. And so as a constituency MLA, I'm working at that local level, but also taking that work and bringing it out at the provincial level as well.
One of the big issues on this is the issue of fish farms, not only for its environmental issues, but also for its effects on Indigenous sovereignty. How do you believe that the government has, the appetite to really work really work on this and maybe even transition to closed pen farming?
I'll just say this. I think that we've heard the right words. The language has been good. The government supports wild salmon. The actions have not backed up those words yet. And so we'll see what happens when they have to make the decisions about fish farm tenures in the Broughton Archipelago. There's about 20 odd something. And I think that, when we're taking a look at this from a constituency perspective in Saanich North and the islands, people will say, well, there's no fish farms in Saanich North and the islands. Why would you be worried about it? But the reality is that those salmon that fed our coast, those salmon that come into the southern Gulf Islands, into the Salish Sea, and feed before heading up the Fraser River, go right past, as juveniles, they go right past the fish farms in the Broughton Archipelago and further the north end of Vancouver Island as they're heading out to sea for their time out there. And so I think that it's important that we understand the interconnectivity. Decisions that are made in northern Vancouver Island and decisions that are made in archipelagos that are seemingly far away from our riding in Saanich North and the islands have a dramatic impact on our riding. And it's not just in fish, it's in virtually every other policy as well. We have to respect and understand the complexity that we're dealing with and recognize that decisions that we make for policy in one place of the province seemingly will not impact the rest of the province, but in reality they do.
Mm-hmm. Let's move a little bit to an area of the budget that we haven't talked about yet, the speculation and the health taxes that have come in. We noticed that the Minister of Finance sort of fine-tuned the speculation tax the other day. What do you make of it?
I'm thankful. We heard a lot from on both the speculation and the health tax. We've heard a lot from people, and on the speculation tax side of it, we heard from people who have had long-time cabins, or family cottages that they may have inherited or purchased as a place to go to in the summertime. That's largely been the economy of the Gulf Islands has been one where in the summertime it's very busy, and in the wintertime there's much less people living there. We knew that was going to have a dramatic impact on the economy of the Gulf Islands to have those viewed as speculation. We, as a BC Green Caucus, argued that we actually needed to be dealing with the cause of the problem, and that people's vacation homes on the southern Gulf Islands were not the cause of the housing affordability crisis in our province, and they should not be targeted. And we're thankful that the minister heard our calls to remove the southern Gulf Islands from the speculation tax, and so that was something very positive that happened. On the health tax, we've long said that we need to get rid of the MSP premiums. It's a regressive tax. It's not fair for British Columbians. The people who make less in our province pay more percentage of their income to health care than those who make larger amounts of money. And the government has been saying that they're getting rid of the MSP. And I would just like to point out that while they're getting rid of the MSP, they're actually not. They're actually just shifting it. They've shifted it from people and they've put it directly onto business. Their own task force that was asked to take a look at this policy of removing the MSP and finding ways to pay, because healthcare is not free. It costs us a lot of money, as we talked about earlier in the show. We need to find a way to pay for it. And their own task force said they need to be split. That they should split it between people and business, and perhaps find another, and there's other sources of income that they're going to be bringing forward in their final report. So I think that it's important to point out that both of these taxes we've worked very closely with government on, and we're happy that we've had some changes on the speculation piece.
That's great. Adam, I want to thank you so much for joining us today on Constituency Report. Do you want to tell folks how to get in touch?
Yeah, absolutely. You can find me on my website at adamolsen.ca. Most of the work that I do in the legislature, if not all of it, is on there, posting the videos. Email us at adam.olsen.mla@bc.ca. You can find me all over social media and your favorite platforms.
Sounds good. Thank you so much, and thank you for watching.